Medicare Mark Fuchs here, trying to help people understand the difference between a Medigap plan or a Medicare Supplement plan, two words that mean the same thing, and a Medicare Advantage or Plan C, right? Again, two words that mean the same thing, but very different ways to pay for your health care, right? When you have a Medicare Supplement plan or a Medigap plan, okay, it is the government and the insurance company who you have that Medigap plan for, they are working together to pay your healthcare costs. As long as you see a doctor that accepts Medicare and that doctor performs a Medicare covered procedure, there are no questions, at least in the state of Oregon, there are no questions, right? It is covered. Your Medicare supplement plan or Medigap plan covers your portion of what you would have paid with traditional Medicare, right? If you have a Plan G, it will cover all things except for the $283 deductible. If you have a Plan N, it's everything except the 15% excess charge and the deductible, right? Different plans offer different levels of coverage. Okay, that's what I'm getting at there. Again, Medicare covered, Medicare approved doctor performing a Medicare covered procedure. Things that are not covered under Medicare are your teeth, your eyes, your ears, the gym membership, prescription drug costs, right? Those things are not covered under traditional Medicare, so they are their own expenses that you will have to budget for or purchase additional plans for. Okay. So that's our supplement plan. That is a Medicare supplement plan or a Medigap plan. Again, two words mean the same thing. All right. So now we go to a Medicare Advantage plan or a Part C, right? Two words that mean the same thing. Medicare Advantage and Part C. They go together. These work differently. When you agree to have a Medicare Advantage plan, the government pays the insurance company your Part B premium along with additional funds that you have contributed into the system over the years through your FICA tax. Okay? Because of the relationship of that insurance company and the government doing that, in turn, the insurance company becomes 100% responsible for paying for your care. Okay? Because they are 100% responsible of paying for your care, your insurance company or the insurance company is going to have specific doctors that they are comfortable billing or that they are comfortable paying. This is called a network, right? If you have insurance company A and your doctors are at hospital system 1, 2, and 3, as long as insurance company A has a relationship with the doctors and the facility 1, 2, and 3, there should be no problems. That is a network, right? So it becomes really important to make sure that the doctors that you want to see are covered by the insurance company that you want to have the Medicare Advantage plan from. People get in trouble with this because they don't double check these things and they don't make sure. And by the way, these things can change. Okay. So I'm sorry, that's just our system. Okay. All right. So that's the network, right? If you have a Medicare Advantage plan with limited exceptions, you need to see somebody who is in the network. And by limited exceptions, I mean a PPO style plan, although those are quickly kind of shrinking. That's a whole other video. Anyways, so that's our network. You have your Medicare Advantage plan, you need to see a doctor in the network. Okay. When you go see that doctor, the doctor is going to say that you need this procedure and that medication, right? The insurance company can come back at times and say, are you sure that they need that procedure? And are you sure that they need that medication? Have you tried this or have you tried that? Right? This is a prior authorization. This is essentially a prior authorization. keep in mind that the insurance company is 100% responsible for paying for your costs of health care. So before they write the check, they are going to want to make sure that that what you're doing really is needed and really is necessary, right? Where people get in trouble with Medicare Advantage plans, or where I see people get in trouble with Medicare Advantage plans, is that they focus on these extra benefits and they focus on these extra things that Medicare Advantage plans do, which are wonderful, don't get me wrong. But they don't pay close enough attention to who the doctors are and are they in network, right? That can be like a deciding factor. I encourage people, if you are looking at a Medicare Advantage plan, again, whichever option you go with, right? Yeah, everybody is an individual. How you get your health care is your business, and how you want to pay for your health care is your business. I don't believe there is a right or a wrong answer. Okay. Um, I just encourage you, if you're looking at Medicare Advantage plans, make sure that the plan that you're looking at is accepted by the doctors that you want to see, right? Sound solid advice that has nothing to do with any insurance company. It's just good advice from a Medicare broker. So, um, thank you. I appreciate you. If you hung out for 6 minutes on this, man, thank you very much. Have a great day.